All right. Hello, everyone. Hopefully you can hear me. I am Joanna Valderrama. Um, Matt, can you chime in and just let me know if you can hear me?
You hear me?
Perfect. Okay.
We can hear you.
Awesome. Thank you so much. All right. Got a few more people coming in. And I'm going to go ahead and share my screen. So hello, everyone. Welcome to our Washington Chapter's HIMSS event. Today we're going to talk about patient and customer engagement experience. I'm Joanna Valderrama. I'll be facilitating our event today. And then Matt Clark is also on, and he'll be assisting us with all our questions and answers. If you encounter any issues technical-wise, for some reason you can't hear us or see us, please go ahead and give him a ping. And you may or may not notice on the far right of your screen, there should be the ability to open and close a tab. On there, you'll be able to post questions, and we'll address your questions at the end of the session when all of our guest speakers have presented. Okay, sorry, I'm just trying to let everybody slowly coming through into the lobby. So, all right. So again, I'm Joanna. This is Dwayne Neufeld, our president. He was unable to join at this time, but he will try to join shortly. So today we'll be talking about and learning from our various presenters how technology in the healthcare IT setting can support our patients through their healthcare journeys and how they've managed to maintain the patient engagement as these technologies evolve and continue to evolve. So our agenda today is just going through the introductions. Then we have Christina Bell, who's a Senior Director System Access and Innovation at Seattle Children's. Then we have Tony Morris, who's the Executive Director of Experience and Engagement at the John Muir Health. Then we have Matt Colomia, who is the Executive Director of Strategy at Providence Digital Innovation Group. And then after that, they'll have about 20 minutes each to share their insights and their experiences. After that, we'll have Q&A. So again, if you have any questions, please post that in our Q&A tab. And then we have a quick survey at the end, and then just a little information about our next event, which is taking place on September 28th, if you're interested in joining. All right, so just a little bit about HIMSS. If you're new to HIMSS, we are a nonprofit organization, and we strive to be the global advisor in various areas, such as consulting, health policy, research, news, analytics, education, networking, and events. And our chapter is specifically focused on our members that are in the Washington area, although we don't exclude anyone. If you are interested in joining HIMSS as a member and getting access to all this information and for us to be a resource for you, you can join at this link down below, or you can just Google HIMSS.org. And just a little bit about our vision and mission. Again, it falls in line with what I mentioned earlier, but it's really to help reform the global health ecosystem through the power of information and technology. So just really being a resource for clinicians and vendors and anyone who's really interested in healthcare IT. Because we're a nonprofit, we also have sponsors. So this is just a thank you to them. We also want to thank, of course, our paying members. So let's get into the topic of today, which is, again, patient engagement. What does it really mean? So if you think about your experiences as you go through your healthcare journeys, we've all had experience probably in the last year in terms of scheduling an appointment or maybe a COVID-19 test through an application or through the phone. So that's an example of patient engagement. In other aspects, you might have been contacted via phone to schedule an appointment, or it could be a follow-up. So throughout your healthcare journey, all these different touch points are important for you, but also for the healthcare providers that are assisting you. So today we're talking about all those different healthcare uh, access points and how the various organizations help to improve the engagement at those points so that at the end of the day, you'll have a good patient experience and good patient care, quality care. So this is just a screenshot of something that I found in the Patient Engagement Summit white paper from 2019 from CLASS. If you're not familiar with CLASS, they're an organization that kind of has non-biased they do non-biased research on different healthcare applications and platforms so that you as an organization in healthcare IT can have a comparison between these different platforms and softwares across the board. So they did an analysis of patient engagement um, software platforms, and these are the different criteria that they evaluated the software against. So for example, provider search, or if you're looking into self-scheduling, self-registration, these are the things that they compared across the board, different applications. So these again are examples of where patient engagement touch points take place. Okay, so this is something that new that we're trying, and it's a active poll basically. So if you're interested in participating, what it is if you scan the QR code on your phone, it will bring you to this poll question and you can answer with a word. So the question in this case is, what are some things that can impact patient engagement? So what I would do is take my phone, use my camera, scan it. It will bring up the poll, and then you can type in a word. And at the end, hopefully we'll have at least more than one response. Again, we're trying, this is new, so go ahead and give it a try. I'm gonna do it on my end as well, and you'll see the count. Oh, looks like we have one answer, yay. And at the end, we should come up with a word cloud. So I'm gonna give this a try too, so at least my count goes up. And like I said, this is something new we're trying to um, implement in all our events just to increase the engagement and participation rather than you guys just watching slides and people speaking. So I'll give it another few seconds while you all do that. Our count is 12, yay, that's great. Cool. So I'm gonna go ahead just in the interest of time and flip to your answers. So it looks like you guys find that technology, but most important, trust is a big thing that can affect patient engagement. So cool, this is great. And so hopefully some of these themes will be echoed through some of our presenters' content. And if not, we can address those in the question and answer section. Cool. Yep, communication is a big one. All right. So let's meet our speakers. Again, I want to thank them, and then what I'll do is I'll hide my camera here. Is I want to thank them again for taking the time to agree to present to us today. We're all busy right now during this time, during this pandemic. So again, I appreciate all the time you've taken to commit to here and just creating the content. So our first speaker today is Christina Bell. Again, she's a Senior Director of System Access and Innovation at Seattle Children's. Then we have Toni Morris, who's coming to us from John Muir. She's the Executive Director of Experience and Engagement. And then Matt Colmia, Executive Director of Digital Strategy at the Providence DIG Group. So first up, we'll have Christina. There she is, and I'll flip the slides. All right, I'll put myself on mute.
Thank you so much for that introduction. I'm really excited to be here today to speak to you guys about our approach to patient experience. Next slide. So to really dig into kind of our agenda and approach, I wanted to first kind of articulate who we are on the digital side of house as it relates to patient experience. Next slide. So our team, DPACE for short, or Digital PACE, which is our Digital Patient Access Care and Engagement Group at Seattle Children's Hospital, is made up of 3 delivery teams, which I will show you in a moment. But really, the way that we kind of grounded the work that we approach and do as a team is really centered around our mission and vision statements that we created for our team. And we have our fundamental objectives, or our 4 kind of pillars that we lean into as we develop products to support our patients and families within our organization. I think one really important thing to highlight on this slide around the vision is really the focus and emphasis on creating ease of patients' experience and really kind of reducing the stress and the barriers that we know the digital experience and just healthcare in general potentially creates for our patients and families. And so we really wanted to spend a lot of time focusing in on how can we enhance communication, really modalities of care, personalize the experience, and really do it all with the lens of promotion of equitable access. Next slide. So this is a bit more about who we are at Seattle Children's, and DPACE more specifically, is we're made up of 3 delivery teams. I thought this would be beneficial to kind of show you all in terms of how are we structured and then how do we work as a team. And so we have 3 verticals, or 3 delivery teams within our digital group. One is dedicated to our virtual care experience, thinking about telehealth, direct to consumer, clinic to clinic, e-consults, and other opportunities in that landscape. We have our patient access and engagement, which is really centered around our digital front door and patient communication, omni-channel platforms that we want to leverage to really be able to engage and provide a comprehensive communication pathway to our patients and families. And then the third is around that patient immersive technology, or immersive engagement, which is really focused on a collaboration with our facility partners and our in-clinic or inpatient partners to really provide a educational, distraction, edutainment center and space for our patients and families at Seattle Children's. So think of things like digital displays, iPads with different kinds of applications and tools for patients and families to use for education and distraction while they're going through their experiences within the hospital system. And one of the key parts that we find has led to our success as a delivery team is the leveraging of advisory teams. And so we have a cross-functional advisory team that we meet with and engage with on a regular basis. And we find that this is a really important piece of the puzzle in order for us to really develop comprehensive products that not only are we partnering with our IT partners with to create, but our operational partners to deploy and find success with. Next slide. So this speaks a little bit about our approach. So digging in a little bit further around the advisory groups that we create. So one, we have a cross-functional team that we support within our internal partners within the organization, but also very importantly, we partner with our patient experience teams and have developed patient advisory groups. So we have multiple patient advisory groups that we have within our organization. One of which that we typically lean into is the one that is centered around supporting IT-based initiatives. And so we meet with them on a monthly basis, and we constantly bounce ideas off these family members and guardians that receive care for our patients at our organization. One of the important things to note is we really are focusing on how can we improve the diversity and inclusion of our patient and family groups. So we really have a holistic understanding and approach of if you speak languages other than English, if you have limited literacy in technology, how can we continue to engage and personalize the experience for our patients within the organization in a meaningful way as we continue to deploy new technology and new experiences for our patients and families. We also have partnerships with our graduate programs at University of Washington. One capstone to note is a deep dive that we did in an analysis to understand what is the impacts of telehealth and portal use within our organization. Again, there was a strong recognition really focusing on that equity of experience around the limitations that portal use can create, especially in pediatric organizations. And so it was really important for us to take the time and energy to understand where those potential barriers might play in and see how many of those barriers we could potentially reduce to allow for engagement for care. We also leveraged UX design students. We do have an in-house UX designer on our team that is dedicated to help also supporting the design experience that we're creating for our patients and families. We also did this really great mapping, which I've included in the appendix of this presentation if you're interested to see. But it's really talking through what is our social vulnerabilities across the state of Washington and how are we better able to understand and address those that we have control over, such as broadband connectivity, device limitations for our patients and families, literacy, and ultimately engaging in better trust with our patients, the more we can reduce barriers and ease access to care. And last but certainly not least, we also leverage a lot of different metrics within the organization focused around different areas of access and engagement, which we stratify by race, ethnicity, and language. So again, we have a comprehensive understanding of how to meet our patients, where they're at, and how can we best support them. So how do we put this into motion? Next slide. Is really through a combination of the previous slide and all of the kind of analytics and data that we're able to collect and understand on our patient experience, as well as reaching out and literally having focus groups or working with our patient advisory groups to connect and understand that patient journey and experience. And then we couple that with this journey map. So this is a sample of our Seattle Children's Journey Map, which our patient experience team has put together. And I think it's a really incredible tool for us to use to help ensure that we are aligning across different strategies within the organization and making sure that we have the patient experience and the patient journey at the forefront of our minds and energy and effort when we're delivering any sort of product to our patients within the organization. As you might imagine, we're really focused in on that before, or how do we engage them into the system as a highlighted area of focus for us at this point in time with our enhancement of virtual care opportunities, as well as portal use engagement, front door digital application, and other communication tools and pathways that we are creating for our patients. Next slide. Next slide. And with that being said, we really want to look at how do we put that into motion. So not only do we know sorry, go back one slide. There we go. Not only do we know that that journey is critical of importance, but we also need to have the interconnected relationship between all of the different elements that we want to accomplish. So because that patient journey is really a continuum of care from beginning, middle to end, and then back in through that system again, depending on the illness, depending on the needs of that patient, it's really important for us to also recognize that as we're working with cross-functional teams and our operational and technical teams to deliver these comprehensive and meaningful products, it's all interconnected. So it's really about how do we put that data and those experiences into motion with recognition of digital inequities that exist for our patients, depending on their social vulnerabilities, and how do we kind of ensure that we're reducing any sort of barriers to those inequities while providing comprehensive and supportive services. And we work through, next slide, and we work through this with strategic partnerships. So we definitely don't do this alone within our organization. We do this in partnership with a couple of vendor applications Predominantly AWS is kind of our new communication platform. We're entering into a partnership with Google to explore machine translations and AI capabilities with chatbots. We're currently leveraging Zoom as our predominant telehealth platform for our ambulatory direct-to-consumer services or direct-to-home services. We also have a partnership with Teladoc for our inpatient, our NICU, and other clinic-to-clinic virtual care services. We also, with my developer team that I have on Access and Engagement, in addition to that front-facing, that Seattle Children's application that we created, we also do other things, other projects like Celebration and other applications for foundations and other areas of the hospital. So we definitely couldn't make our digital experience possible without these key relationships and recognition and understanding of where do we need to build versus where do we need to buy, and how do we, again, deliver that meaningful product, because just because we build a product doesn't mean that that patient is going to be invested or want to use that product. And same with our operational partners. So we have to ensure that we are aligning all of those pieces to be able to cater to that patient journey for our patients within our organization. Next slide. And that's it. And I left a ton of stuff in the appendix just so you guys know. There's quite a bit of analytics, hardware, if there's any hardware questions, and that'll be, and text samples and other things that are available in my appendix information as well.
Great. Thank you so much. Yes, so if you put something down in our little game there, poll about trust, communication, technology, she addressed all of those things, you know, through advisory groups, the mapping that they're doing, the metrics, all the strategic partnerships. So that was great. Thank you so much. All right, it looks like you're launching a new app on this next month. Cool, tomorrow.
It's our 2.0. So yes, so this is our second iteration of the app that we have already launched. So we included a carousel. It is also available in Spanish, and so we've just continued to iterate on the design. We also have beacon capabilities, so we have wayfinding that we offer through this application for our patients when they go to the main campus, so they can have step-by-step instructions. Say you need to go to Starbucks or you need to go to a particular area within the hospital. This application can help guide you to and from the different locations within the main campus, which can be a pretty cumbersome experience.
Great, and that's probably just a good example of how even though you're creating all these cool apps, you do also have to keep in mind that you want to make sure the patients and whoever uses it actually find it useful, right? So that's probably some of the changes you've adopted in this new version.
Absolutely. And the funny thing is while this is intended for patients, we've actually had quite a bit of interest from our provider groups, including our code groups, saying if they could leverage this as a way to be able to get around the hospital and get to the codes more effectively and efficiently. So we've had some provider groups that have kind of leaned into this product because of its benefit and use with the wayfinding.
That's perfect, right? And that's kind of why we also titled this event the Patient and Customer Engagement Experience, because it's just not the patients that are being affected, but all the various roles, clinicians, and like you said, the different provider groups or the coders that can utilize these things. Thank you again.
Thank you.
All right. Let's see if I could switch over. Oh, there's more. I'm just gonna flip through these. And next up, we have Toni Morris. Again, she's the executive director from John Muir on experience and engagement. She has over 20 years of experience in areas of organization development. And she was also awarded in 2012 Executive Woman of the Year by the NAWBO Sacramento for her outstanding leadership, among other wonderful things. So, Toni, I will leave it to you. I will mute myself.
Thank you, and I'm really excited to be here. I'm actually really honored from another state to get to come and talk to you a little bit about our organization and some of the things that we're doing. So thank you for having me. Next slide, please. So a little bit about our organization. John Muir Health is a mid-sized health system located in the Bay Area of California, just east of San Francisco. And we compete primarily with two large health systems in the area, which is Kaiser and Sutter Health. And I personally have been with John Muir since 2018. And prior to that, I was a managing consultant with Press Ganey. And a lot of the work I did was very similar to what I'm doing at John Muir now, which is focusing on patient consumer experience and then employer and provider engagement. These are things I'm very passionate about and have throughout my career. While I've had a lot of different roles in leadership, this has been my favorite part and I think the most important. Next slide, please. So recently, if I don't count COVID year, it would only have been a year ago, but a couple of years ago, we started our journey with MyChart. And prior to that, we had an app that we used called MyJMH that was developed in-house, but it was limited on all of the things that it could do and our ability to move quickly and add things. So we made a decision to move over to MyChart since we were on Epic already and there were so many enhancements that were already available to us. And this turned out to be a really great thing for us to get started and launch pretty quickly. We migrated over to MyChart and it simplified the conversion process. So at the time when we were launching MyChart in July of 2019, we only had about 30% of our patients that were active on MyJMH. And so we created a campaign and both to educate our staff and engage them in the process, as well as our providers, and help and inform them about how they can encourage patients to sign up and how the value that it would bring to our patients. And the key components of our planned launch included things like education, marketing, and communications. And so some of the things that we did, we actually had scripting for them. We had prizes, so we had the practices kind of competing with one another. And the bigger launch was in our outpatient division. And when we first started the program, we had the 3-month campaign that we were planning to hopefully grow the number of users, active users. We started out, there was about 30% of our patients, and the goal was to get to over 50% of active users. And we created frequently asked questions for people, not only for our staff, but for the patients. So if they weren't sure how to use it, we also had some people in-house that were able to help people log in when they came for their appointments so that they could learn kind of with someone at the elbow showing them how to use it. That we had buttons that talked about MyChart, have you signed up yet? So we really did our own in-house marketing campaign around that. And we were, at the end of the campaign, we didn't quite achieve our 50%, we were at 49%, but we've continued to grow this number, and today we're at about 60% of our patients are active users. Next slide, please. So this was some data from the MyChart that I thought was really interesting, and this is more recent, but it shows the number of active users and their age ranges. We thought this was interesting because if you were to interview staff and providers and even some patients and ask them who they thought would be the highest utilizers of an app to access their medical records and schedule their appointments, most people thought it would be the 50 and younger. But as you can see, the 51 to 70-year-olds were the highest percent users. And then even 19% of 71 to 90-year-olds, which was pretty fascinating. And that helped us kind of gear which enhancements we were going to add each year based on that demographic and what would be most helpful for them. Next slide, please. So also during COVID, we had originally planned our launch of telehealth, but it was over about a year process that we thought we would launch it and have everything just set up perfectly. And what happened was COVID, and we were able to actually launch it within 2 weeks from when COVID hit, and we knew this was something that if we didn't have it, could really devastate the organization. So surprisingly, how fast we got it up and running and how well it worked right off the bat. At the same time, we launched our telehealth specific patient surveys through text and email. And so along the way, we were able to get direct feedback from the patients about their experience with the telehealth launch and what was working well, what they liked about it, what was challenging about it, and have been able to make a lot of our improvements based on that feedback. Next slide, please. I just wanted to share a little bit about what the customers were saying about it. And one of the things that was really fascinating is they felt like really connected to their providers. Some of them felt like they were more connected on the telehealth visit than they were in person. And we kind of speculated as to why that is, but some of us were thinking because your physician or provider is looking right at you the whole time, and you can see it's really almost an intimate interaction. And so they have to really focus on you to make the visit, make sure they get the questions answered and understand what the patient's needs are. So they felt really included in the visit, felt like they were part of the plan. So a lot of really positive feedback about the telehealth visits, the video visits in particular. We did have some challenges with the connectivity, especially launching it so quickly. So we were able to set up a team that was able to call the patients ahead of time, help them get set up, and so they were prepared at the time of their visit, and they went much smoother. And they really enjoyed that face-to-face or kind of one-on-one, I guess, experience of someone helping them make sure they had a successful visit. Next slide, please. So another way that we access understanding our patients' experience and what their needs are is our Patient Family Advisory Council. And when I worked for Press Ganey, I worked with a lot of health systems across the country, and pretty much everyone has a PFAC. But I've never seen one that was as active and engaged as the one that we have at John Muir, which has been really phenomenal. They are involved in projects, they do training, we do some in-person where they will play the role of a patient while we're training staff on a new process and making sure that the patient is thought about in how we implement something new. They also are a group that we can always bring when we're getting ready to launch a new technology or perhaps a change to our website. We can have them look at it first and test it and give us their feedback so that we can tweak it if we need to, or perhaps not pursue it if it turns out that they feel like it's not something that really adds value for them. So our PFAC committee has been really awesome, so much so that we've really focused on recruiting and growing the number of participants. And right now we have about 18. And they're a wide age range. Some are parents from our NICU, and we have seniors. We have patients who previously had a poor experience and joined us to help us make those experiences better for others. So really a great tool for us and has been incredibly valuable. Our IT folks come and present at our committee meetings on a regular basis, probably every other month. To share new technologies and new ideas that they're pursuing to see what our patients think and if that's something that they would use on a regular basis, or perhaps what are their questions that we need to think about as we make it a better product. Some of the other things that we're looking at right now, we're in the process of implementing a new called a behavior checker for our pediatric population. And it's a tool for our providers to share with parents who are having challenges with behaviors in their children. And there's little tools of things they can try before they determine that it's something more serious and they might need professional help. So that we're hoping to launch in the next couple of months. It's in kind of a pilot stage right now. Another area that we've launched as a pilot is a transportation program where there's actually an app that helps us schedule patients who otherwise might miss their appointment or might be a no-show to the appointment, and we're able to help them get a ride if that was the issue at hand. And scheduling that is through a service that has an app also. We're continuing to expand our MyChart, and there's enhancements. It feels like every month there's something new that we could be offering, but again, before we decide on which enhancements we want to use, we're running those by our patients, we're testing them and getting their feedback. Next slide, please. So the other thing, because this is another big part of my job, staff and provider engagement, I wanted to highlight that this is key to our success. We need to provide them the tools and information that they need to be able to help patients feel good about any technology or solution that we're offering. And if they're familiar and confident in it, it's much easier for them to help our patients with it. So if we don't engage them, the other part is sometimes there's a tool that might be something a patient is interested in, but it might conflict with our workflow or something that's happening on the operations side. So we want to connect the dots on that too and make sure everyone's engaged and creating that great experience. In our current COVID environment, these programs, projects, tools, all of this have been even more important because our staff and providers have their own concerns about their own safety and their own health. And so that communication and some of the tools that we've implemented around communicating, maybe it's around the vaccines or about our PPE or about our telehealth, some of the tools of getting that message out through text messaging, et cetera, has been incredibly valuable and making everyone feel a little more included and thought about in the process. I have a much shorter version of my presentation. I didn't know how long this would take, and I was asked to kind of highlight a few of the things. So I'd be happy if anyone has any questions. I know we're going to do that at the end, so I'm happy to take any now too.
Focus really at Jamir is trust and communication to help drive the success of your various engagement tools. For the behavior checker and transportation app, the drivers for those, do those come up from your PFAC meetings, or is that something?
So for the transportation, that came about because we were noticing our increased number of no-shows and late cancellations. Mm-hmm. And we weren't sure what that was. So we were looking into, what is it? And it seemed that we had a significant number that had transportation challenges. And so we did a pilot with that. And the return, what we found is if we could even get 5% of those cancellations or no-shows to attend, to come to their appointments with transportation support, the return was worth it. So we're continuing to expand that and look at other options. There's a couple of new players in the market that we're looking at that have some probably easier ways to manage the process. So we're right now we're currently looking into that.
Great. Okay. Thank you. If you have any other questions, put that in the Q&A tab, please, and we'll address those after Matt, who is up next. And Matt is the Executive Director of Digital Strategy for the Providence Digital Innovation Group. His team is responsible for identifying opportunities for digital solutions to solve clinical, operational, and business problems for the health system. No pressure, right?
It's easy,
Yeah. He has experience in enterprise strategic planning, payer-provider partnership, and the development of population health companies.
Thanks, Joanna. Yeah, let's get started. I don't know why the thing looks funny. It's supposed to say patient engagement. It's fine. I'm sure you caught that. So I'm the strategy person on the DIG team. Unfortunately, our product person wasn't able to join today. So I'm going to mostly kind of talk about this through how we view the world at a macro level. And then we'll sort of talk a little bit about what we're working on. If you go to the next slide. Or can I advance the slides? Or should I just ask? Next slide's fine. We'll do a quick intro to Providence and DIG and talk about how that fits. So Providence is 51 hospitals, 120,000 caregivers spread across 7 states. I am in Seattle. Our digital innovation group is run out of there. If you go to the next slide, we'll talk a little about sort of our role within the organization. So the digital innovation group, we just call it DIG, serves as kind of the hub for new consumer technologies at the enterprise level. So we spend our time here at the intersection of sort of the traditional healthcare industry, also technology companies, and then of course, our healthcare consumer. We have a business model that's maybe a little bit different than other groups. If you go to the next slide, I'll kind of talk through how that works. But part of what we do is build and spin out companies. So the way that we operate, we start with our digital innovation domains. And we have a few domain areas that we've partnered with our executive leaders and said, these are the areas that we're really going to focus on. My team on the strategy side will go out and sort of run kind of a consulting project. A lot of us have consulting backgrounds. Sort of define those opportunity areas and size and prioritize those, and then kind of figure out, like, hone in and say, okay, here's the area that we really need to focus. And this is not the area that is just important for our business, but for other health systems as well, or the rest of healthcare as well. Then we go through sort of our little tech cascade process, we call it, which is where we need to understand, it's sort of a build buy analysis, but we bias towards not building. So we'll look internally to see whether we already own something that could solve this problem. Then we'll look externally to see whether anyone else is solving this problem, and then we can bring that in and pilot it, and then potentially scale it. And if we don't see anything internally and we don't see anything externally, we have a large engineering and development team and product team that can actually build and spin out companies. So if you go to the next slide, I'll talk about a few of those really quick. We've spun out 3 companies in the last 4 years. Zelth is sort of a digital formulary for digital health tools. Wildflower is we spun out the maternity app, Circle, sold to Wildflower, a great partner in maternal health and families. And then our most recent, in 2021, we spun out DexCare, which is our same-day low acuity care. So if you want a quick visit, if you want to schedule a visit and an immediate virtual visit, DexCare focuses on, at least focused when we spun it out, on sort of that space. We also have within our ecosystem Providence Ventures, a venture arm that we'll partner with when maybe we don't build something, but we partnered with a company and have scaled that somewhat within our organization. Providence Ventures may come in and decide to make an investment. So they're a strategic investor within our space. Next slide. And actually you can go forward too. And I'll start talking a little bit more about, oh, this isn't some intense font. I'll talk a little bit more about, okay, why digital engagement? And this isn't supposed to be super scary, though when we made it, it was supposed to be super scary because we're presenting to executives and we need to scare them a little bit. But really, this is the ecosystem kind of that we see, especially coming out of the pandemic, which has accelerated so many disruption threats in the space. We see significant disruption potential from a lot of our digitally enabled competitors. So there's a couple of different sides of this. So one, there are these digital first disruptors. These are the sort of Amazon Cares of the world, but there's a billion of them, and you see them raising more money all the time. And then there's sort of these national payer provider platforms. I'll talk about each of them a little bit, but these digital first disruptors have a few advantages that are really important to note. One, they're digital first, so their legacy systems are not built the way ours are. They don't have the brick and mortar challenges that we do. They don't have the scalability challenges that we do. And it allows for standardization in a way that we, at least at Providence as a health system, really struggle to do. They're coming in to target profitable services. They're not looking at traditional fee-for-service reimbursement. They're a lot of times just going straight to cash pay. And they can decide, and often do decide, simply not to cover certain parts of the continuum of care that are just less profitable. We'll talk a bit more about how they kind of go right after our margin on the next slide. Lastly, they can focus their care provision on a really clear, narrow consumer value prop. So, HIMSS and HERS or Roman are an easy example of a very specific healthcare need that they can focus their operations around. They can focus their marketing around it. They can become known as a brand. I saw one of Roman's ads just yesterday while watching Hulu. They can really build a focused care brand around something specific in a way that come get your care at Providence no matter what your need doesn't always resonate as much. On the payer provider side, they admittedly have a lot of same legacy challenges that we do, but so much of the new data integration potential and interoperability laws that are coming out are shoving payers into a more digitally integrated world. And within that ecosystem, there's a lot of really fascinating opportunity. Obviously, they own the full premium. That gives them the opportunity to be a lot more creative than those still tied to fee-for-service. The number of times that I'm sure a lot of us have said to ourselves, oh, well, this will work in value-based care and we're not quite there yet. They don't have to say no to those opportunities. They also have a strong balance sheet coming out of the pandemic. Candidly, the payers saw record profits in the last 2 years. A lot of health systems struggled. They're ready to take that money and that windfall and invest in some best-in-class engagement tools. So we see a lot of activity in that space, acquisitions and more. Next slide. So it's easy to see kind of how these can add up to a big problem for health systems. The first important note, and this quote at the bottom is always scary. Everything about Amazon's scary, but your margin is my opportunity. It's important to note that a lot of these disruptors are really primarily looking to serve commercial populations in profitable services. So they're coming out to carve out the care that a lot of health systems use to cross-subsidize their less profitable care. And each step in this journey is really an opportunity for a disruptor to just be a little bit more Googleable than us, or a little farther upstream, or a little easier to access. And each one of those also represents for us a missed opportunity as a health system to be the patient's partner in health. So the more relationships that a patient builds outside of our ecosystem, the harder it is for us to coordinate and manage care, the harder it is for us to personalize and provide the full continuum of care. And over the long term, it can certainly cut into the margins of health systems. Next slide. So I'll talk a little bit about some of these macro trends, but I want to make sure that we have plenty of time for Q&A at the end. One of them that we're seeing emerge is the data advantage that digital first systems are starting to have. So so increasingly, it used to be that the data that was created was mostly in the EHR, right? The health data that existed in the universe, if you were to sum it all together, it's really in the EHR. That's less true anymore. Through like wearables or apps or content and other consumer tools, it's growing really quickly. We're starting to get to the point where the amount of actionable healthcare data that exists is primarily outside of the EHR. And so that hasn't arrived yet, we don't think, though it's hard to define actionable, but we're certainly seeing, Apple being an ecosystem that, just as one example, is really getting a lot of fascinating health data that isn't accessible to the health system. So they can build out these rich consumer profiles based on stuff that we don't even get access to. There are a lot of regulatory changes. Those regulatory changes are more likely to help disruptors than health systems because they're in a different place in terms of digital readiness. An easy example would be like if cross-state licensure laws are relaxed, for example, a virtual first care provider can scale way more quickly than a brick and mortar one, right? Compliance costs are probably also higher for us too. For data sharing, so this is the one that I think is the most fascinating, but it used to be that if you wanted to build a digital health startup, you kind of had to build your own full tech stack to deliver something to consumers. So you needed to do billing, and you needed to do integration, and you needed to do pharmacy, and you need to do device management all on your own. But that's not true anymore, right? There's Redox and Validic and Eligible and TruePill and Ribbon Health and Patient Paying and other folks like this that are creating an infrastructure that other startups can plug into so they can get from 0 to 60 really fast these days. Now, we could theoretically leverage these to our advantage as well. But again, that tech debt and existing legacy systems mean that we're going to be slower to adopt those. COVID-19's obviously been an accelerant. While, health systems were fighting the pandemic, lots of other disruptors had, chance to scale, chance to grow quickly, chance to often raise money. And the last one, yeah, on that note, funding for digital health was an all-time high in 2020. And I think it passed that number already. I think it passed that number in the first 6 months of 2021. So we're seeing doubling year over year in VC investment in digital health space. So a lot of folks coming in. It's a groundswell like we've never seen. Next slide. I'll skip through this one super quickly, but this is just the basic layout of like, what do we do, right? All the way from do nothing. There are areas where we don't feel like it's a strategic interest of ours. Maybe, in the next bucket down, we need to partner with somebody, or start buying a product that works really well out in the market, all the way to the last option, which is like we need to actually build internally competitive businesses. We need to build a business within ourselves, and maybe that uses some other vendors and some other tools and packages them together in a really powerful way. But do we need to sort of self-disrupt and do what a lot of these competitors are trying to do? Next slide. Okay, so this has been Providence's approach. This was true before COVID, but it's now accelerated as we look longingly towards a post-COVID world. We need to build a core digital infrastructure to be prepared. So this means a few things, and I know there's a lot of jargon on these slides. I'll say the simplest versions of this, but like, first, we have to have unified brand presence across the app and website and more. We've been fragmented for a long time. It's hard to navigate between our tools. Some of them candidly just weren't as good as others. So unifying that across really high quality, investing in those centralized digital resources is core. Second is making the endpoints digitized and accessible. So basically digitized means we need, if there's an in-person visit, we need to make that able to be a virtual visit, right? If we have a schedulable appointment, we need that to be available digitally. We need a provider profile that might exist on a payer website to be searchable and readily available. So digitizing and then making them ready to be ingested wherever we go. So another example of that is if we have a provider profile, let's make sure it shows up on Google, right? So how do we digitize those endpoints and then make them really readily accessible? Third, and this is the area we're talking about today, but like once someone is in our digital ecosystem, how do we make that experience better, personalized, integrated, navigable? Next slide. Okay, so what does that actually look like? If we double click on that last box, right, there are three components that we're hypothesizing are critical for a differentiated experience, right? So the first is, and this one is the most frustrating one, but we're starting to recreate the clipboard problem right now in digital health. So like, if we use Twistle for surgeries and Silver Cloud for cognitive behavioral therapy and Omada for diabetes, the patient has different apps and different logins and different experiences across all of those. We don't manage them. We don't know what happens in them, so we can't orchestrate things really effectively. And those are just three. A patient could have any number of health needs that they're trying to navigate. So we're making them have their own logins and having their data spread all across these different digital tools. And so they have to fill it in every time, just like those clipboards when we get frustrated by having to fill in the same information over and over. So unified access, that top right corner, is like the single sign-on, like data all in one place approach to that. So we need to make that data seamless. So when they move room to room, we're still within that ecosystem. If you change your language preferences on one, we can change your language preferences everywhere. Second, people need help navigating our complex systems. This is another example of us recreating an analog problem in digital, but patients already were challenged to know where to get care because we invented immediate care and urgent care and express care and primary care and the ED and not to mention every other health system out there. But if we had virtual care to all those, we're just doubling that number. Right, we are proliferating the care venue options without helping people understand how to access them better. So we have a chatbot named Grace. That's been a great first step. We've had over 400,000 unique visitors. Most of these are COVID use cases because that's the one that we invested really heavily in last year. But In terms of navigating people to the right venue of care, there's a huge opportunity to solve for that and just make that experience easy for patients. Lastly, experiences need to be personalized. This is the upper left corner piece, but otherwise we're just going to be like pestering patients or like maybe frustrating them. So if messages we send you are personalized, you're more likely to respond positively to it. And if when you come to our website, whether a logged in or not logged in experience, and that experience is personalized, you're going to have an easier time finding the thing you need. We're going to make it faster, and it's going to be a richer experience. Next slide. Okay, and this is sort of what the culmination of this work, and this is still in progress. We have not launched fully baked this product within our ecosystem, but we're new updates every week or so at this point. This is the sort of version 2.0 of the Providence app. We're calling it the consumer engagement platform. It is sort of the back end that powers the Providence app, those three components I just mentioned. But the goal is to really like connect and orchestrate across all our applications service line, support a personalized health journey, and build that sort of stronger relationship with patients. We want to go sort of beyond transactions. Transactions are great. Being able to schedule and all that's great, but we want it to be seamless and like your partner in health between episodes of care as well. There when you need us. Next slide. So our theory on this patient flywheel or engagement flywheel is that first inner loop is the first loop. The big one, put on pause for a sec, because we just need like to build like basic, trust and the word cloud word, of course, build basic trust and competence, frankly, within like a healthcare ecosystem for our patients. So they use the app for their care needs to get access to the EHR. They engage in some sort of experience with us in a digital world. And then we get a slight amount of patient behavioral change, and they get high satisfaction out of that. We get better outcomes. Now with a little momentum on this, we can ask for a little bit more, right? We can do more engagement with the health system between episodes of care. We get better diagnoses and treatment because we know that patient a little bit better now. By knowing that patient, we can reduce waste and get some more cost efficiencies. And this is not just in a matter of like knowing that patient well enough to not refer them to the wrong provider, but also knowing that patient well enough to not send them a message that we don't need to send them, right? We can better align resources with patient needs, and then that flywheel sort of continues. So we think that one of the key KPIs coming out of this is patient churn. So how do we make sure that patients are having a really good experience to the point where they value the health system enough to come back for other services and other care? Because that not only enables us to provide better care, but to reduce the cost of care through better engagement. So better engaged patients can be more likely to adhere to their prescriptions, more likely to follow instructions, more likely to come back to us when they have a need, more likely to know where to go when they have a need. And we sort of ease that entry back into better care. Next slide. I kind of went through this one already now that I'm thinking about it. But these are sort of those three components that I talked about, I want to say 3 slides ago. But it kind of tracks out what the key consumer problems are that we've matched with the components of this. One thing I'll say now that I should have said earlier is that theoretically, you could have sort of an engagement and a navigation, or like a personalized engagement, a navigation, and a single sign-on as totally separate products, I suppose. Like you could build them separately at least. We think that they're not just better together, but crucial to have together. So an easy example is navigation. I don't know if anybody's tinkered around with any of these sort of diagnosis chatbots. Between us, we looked at a bunch of them and found a lot to be pretty lacking. It takes a lot of questions to get to a diagnosis recommendation. And when you get to it, candidly, in our tests, a lot of them just weren't right. So that's not their fault. It's a really hard problem. It's really hard to tackle, no doubt there. But what does that look like when, but part of the reason that it's challenging is that we don't know anything about that patient when they walk in. We don't know anything about their history, their experiences. The questions that we ask have to sort of be a little more formulaic. But with really good personalization, you can make that navigation experience a lot better by sprinkling in more and more data that helps that patient find the way to the right resource. Even if that means making sure it's in the right language, making sure that the provider that you send them to speaks that language, on and on like that. Next slide. So as I mentioned, churn is one of the key metrics that we've been looking at. High engagement before, during, and after episodes, we believe can increase retention, LTV capture, brand loyalty. And with just 1% in reduced churn, this is a, huge opportunity. Lots of good reasons to drive more towards engagement, like high engagement experiences, high loyalty driving experiences. And I think that's my last slide. You can go to the next one. That's it.
Thank you so much. Really like that consumer and future slide. That kind of went along well with our word cloud exercise. You talked about trust in there and communication. I was curious to know, you've identified different ways on which to collect information and improve the solutions or address the solutions. Were there any patient engagement there in terms of having input from the various patients or clinicians on the solutions that you're looking at? Like, how do you figure out what areas of focus to dive into and prioritize?
Yeah, absolutely. All this work is really heavily informed by, so we have several things. One, we have a sort of a patient panel. We have our UX team, which does a ton of focus groups and interviews in that space. We have our provider councils. We have several provider councils that we consult on sort of how to drive these. I think it depends on which phase. Mm-hmm. I think right now we're in the phase of like taking the concepts that we heard last time, building MVPs of them, and then going back to those groups, particularly around user testing for some of this. But other stuff is still in a nascent stage, and we're still sort of shopping around saying, what do you expect from your health system at a high level? So we kind of keep going back to that as we sort of move forward on these.
Cool. And are you looking to launch your app or your second version next year sometime?
Well, so we do new releases every couple of weeks. So there's not like a big launch. Mm-hmm. I think the question that I don't know the answer to, and I have to ask the product folks in more detail about, is like, when will we look at commercializing it? Because anything we build in-house, we do look to spin out. We don't think health systems are particularly good stewards of technology over the long term. The maintenance costs are really high. Our capital structure doesn't really support startup kind of growth models or risk models for that matter. So I think that question is much more up in the air. But we'll be adding in these in stages over the coming months and years.
Cool. Thank you.
Hey, Matt, question from the chat. How has this application been advertised to patients?
Yeah, we actually have for a while had an internal challenge between, do we tell patients to use MyChart or our app? And in some cases, a lot of providers choose MyChart. Our app has MyChart functionality in it, but up until recently, it hasn't had the full breadth of what MyChart had. We had 80% of it or something. But if the provider really liked that last feature, they would prescribe MyChart, or not prescribe, but like recommend MyChart. That's changed recently. So we're at the point now where we have 100%, I think, 100% MyChart functionality baked within this app. So the broader conversation now about how to market is ongoing. We are probably not at the total usage rates that we would like to be, though I don't have them off the top of my head. But that's an ongoing conversation now that's been delayed in part because of a sort of mixed messaging around what the preferred product is.
Thanks. Hopefully that answers the question.
And it looks like there's a question for Tony. Was there a financial value associated with increased patient experience?
Yeah, so what we noticed over a 5-month period, once we launched the bill pay EMI card and online, we saw an increase of 20% of our self-pay payments made, and where we didn't have to send any kind of mail statements or bills or invoices or anything. So it did, we saw a definitely return from that perspective.
All right. Any other questions? I'm looking at the chat. Yeah, I think Sarah mentioned people assume seniors won't use digital tools, but data consistently shows differently. Yes, I agree. I was surprised with the metrics that Tony showed about their percentage of usage in the slides. That was cool to see. Any other questions? Right. If not, I just wanted to share with you, our next event is coming up in September on the 28th, and we have Dr. Osborne, who will be talking about the 5G deployment at the VA at Palo Alto. So if you want to join, you can register. The QR code is down here on the bottom right. Let's see. Other than that, we really want to get your feedback on our event. So we're going to start asking this at the event at the end of all our sessions. So I'm QR code happy today. So you can go ahead and scan that, and that will pop up the Google form for you to fill out. If you could fill that out again, we'd really appreciate it. We want to make sure that we're providing you with content and information and events, the type of events that you really want to see as our valued members. So go ahead and fill that out. I wanted to say thank you again to our speakers, Tony, Christine, and Matt. We value your time. And if you have any questions for them, I'm sure they wouldn't mind if you reached out to them via LinkedIn. And let me check one last time if there are any questions. Nope. Thank you, Matt, for assisting with the question and answer section. Otherwise, have a good evening, everyone.
Bye, everyone.
See you.